Hello, Dr. Evan Shea here, doctor of acupuncture and oriental medicine and physical therapist. Hopefully you're doing well. I'm bringing you today 3 steps, 3 easy strategies that will help you with your low back pain. Chronic low back pain is something I've been treating for almost 20 years clinically. And after treating 200,000 patients, I was trying to find the simplest and fastest way to get you better, right? So I have 3 simple exercises that you could do on a daily basis and that will really knock out that pain for you in your lower back. Now, a few things I want you to understand. When it comes to lower back pain, there's 3 key areas that we always have to address. Number 1 are the ankles and calf. Number 2 is the hips, in the front part of the hips specifically. And number 3 is the thoracic spine, your mid-back. Now, what do they all have in common? When these areas get really tight and really restricted, there's something known as pathobiomechanics that occur. Patho, like in pathology, the study of disease, right? Pathobiomechanics means diseased biomechanics, altered biomechanics. So what we need to do is correct those biomechanical issues. Most commonly, it's the calf, front part of the hip, and then the mid-back. Now, if the calf gets tight, it's going to pull the pelvis forward. If the front part of the hip gets tight, it's going to pull the pelvis forward. If the thoracic spine doesn't rotate very well, it's going to cause the pelvis to rock forward. So they all have the same in common, all right? Now, if we get these 3 areas to work synergistically on a daily basis, your pain is going to get better very quickly. All right, so the first exercise, all you need is a book. This is one of my favorite books by Mark Sisson. Highly recommend getting it. Keto for Life. All right, so you could use a book or a staircase. Now, because we're in my home gym, I'm using a book, so you can actually see what I'm actually doing. Now, I also have a chair, so all we need is a book, a chair, or staircase and a chair, or even just staircase. All right, so if I put my right foot on the book and I step forward, now what I'm feeling into my calf, I'm keeping my calf down, my heel down rather, and I'm feeling a stretch into my calf. Now, what I want you to feel is this. I don't want pain, but I want a tightness, a stretch. Now, there's a couple of different ways for us to hold this position. We can hold it for a period of time, for about 30 to 60 seconds, which is kind of boring, or you could breathe into it. Now, I like doing breath work because it creates a reflex that relaxes the nervous system, all right? So it has a dual purpose. So what we're gonna do now is you can pause this now, or you can breathe with me. I'm not gonna do the full 10 breaths, but what we can do is take a breath in, exhale, inhale, exhale, and every breath I'm getting a little bit deeper into the stretch. Inhale, and exhale. Perfect. Now, you keep on going till you get to 10 breaths. So pause this now and do the stretch. If it's on a staircase, hang one heel off and one foot on the staircase, all right? You could also do both feet at the same time. Feet on the staircase, heels hanging off. I'm gonna switch feet now, same concept. Now, this side's a little bit tighter for me, so I'm gonna take a deep breath in and exhale. And as you exhale, think about blowing out candles, all right? As you're exhaling and blowing out candles, you're actually activating a muscle in the abdominal wall called the transverse abdominis and a muscle called the triangularis sterni. All you need to know about these 2 muscles is that they flatten the abs. What? How crazy is that? Okay, so inhale and exhale. Good. Pause this now and continue the breath work and hold it for about 30 to 60 seconds or 10 breaths. All right, perfect. So the next thing we're gonna do is we're gonna move the book aside. By Mark, enter chair. All right, so with a chair or staircase at home, remember, we want to stretch the calf, stretch the hip flexor, and move the mid-back. Now, look what happens when I sit. What muscles shorten? The front part of my hip shortens. The butt muscles actually lengthen. My hamstring actually lengthens. My calf, look at my ankles. They actually get shorter as well. And then my mid-back gets locked down because a muscle called the psoas muscle actually merges with my diaphragm, which is going to cause my mid-back to lock down. So sitting is the next smoking, or the new smoking, I should say, all right? So what we want to do is reverse this. So you want to put your right foot up on the chair or staircase, like a second or third step. And now you're going to rock forward and back, forward and back. Now, we're going to do this about 10 reps. Okay? and we're stretching the front part of the hip out. Now, an added bonus is if you come in here and squeeze your butt cheek, squeeze the muscle, you're actually relaxing this muscle a little bit more. You're doing awesome. Nice. Perfect. Forward and back. Good. And you can do about 10 reps. So pause this now and do 10 reps. And then come back to me. We're going to switch legs. Left leg up, right leg back. Now we're going to go forward and back. Same concept. Now as I'm actually loosening the front part of this hip, I'm actually relaxing a muscle called the diaphragm. It's our respiratory muscle. Now, when we have chronic back issue, the diaphragm actually becomes a postural muscle when it should actually be a respiratory muscle. So if a muscle is supposed to be a respiratory muscle but it's behaving like a postural muscle, you can only imagine the amount of stress and tension you're going to be under because you're not breathing appropriately. Perfect. Now pause this now and do your sets of 10. All right, the last one. Now this one is my favorite. I've actually gotten rid of knee pain, ankle pain, neck pain just by doing this one simple motion. All right, so from here, we're gonna rotate our torso to the right and then rotate left. And we're gonna compare left to right side. So my right side's typically more restricted. So that's the side I'm gonna start with. So we wanna start with the easier side, okay? So hands across your chest or hands above your head, but hands across your chest is easier. And you're gonna rotate about 10 reps going to your right. Good. 5, 6, 7, 8, 9, 10. Good. Now to left. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Perfect. All right, so we just went over 3 simple exercises that you could do home on a daily basis that's going to decrease, maybe even eliminate your back pain for good. All right. Now the key is this. You don't want to sit for longer than 30 to 45 minutes, right? So if we have a desk job, we got to make sure we're moving around every 30 to 45 minutes. Now it's very difficult, right? I know it's very challenging, but if you have chronic back issues, it's very important that you set a timer and you get up and move, all right? And you can do these simple exercises. If you work from home, it's much easier for you to do it. If you work at the office, it's gonna be much more challenging for you to do those simple movements, but the thoracic rotation you can easily do at your desk. All right, so again, these 3 simple movement patterns will help tremendously work on that pathobiomechanics, the faulty mechanics that you have inside your body. All right, well, thank you everybody for tuning in to this session. I look forward to seeing you on the next session I'm gonna be launching. Please check out my new website, www.vitatype.com. My whole entire product line is gonna be on there. That's taken me 3 years to develop and almost 20 years of evidence-based research to bring my products to life. We're gonna have online courses, online seminars regarding weight loss, nutrition, immune health, as well as eliminating pain using exercise. There's a lot of free videos in there, a lot of free content. There's a lot of courses as well that you could purchase. And I look forward to serving you and helping you at this time. All right, if you like this video, please share it with your friends and loved ones, and let's heal some pain together. All right, Dr. Evan Shea out.